Hello, everyone. Welcome to our another topic for lump lecture series. This time we talk about knee pain, a quick and comprehensive approach. Okay, we all know that knee pain is a universal symptom, no? That transcends age and activity level. It can stem from acute injuries like a torn ligament or meniscal damage, or it can be due to a chronic condition such as arthritis. So symptoms often include stiffness, swelling, and difficulty in bearing weight, making it a leading cause of distress and functional limitation. Now, traditional Chinese medicine sees knee pain not just as a localized discomfort, but as a sign of an underlying imbalance in the body's energy or qi. And as practitioners, we often link this knee health to the kidney channel, asserting that weakness or stagnation in the kidney channel can manifest as knee pain. The holistic approach of TCM seeks to restore harmony through the body. You already know that, addressing the root of the pain rather than just its symptoms. In traditional Chinese medicine, knee pain is often attributed to a deficiency in kidney yang or the presence of cold and dampness invading the lower body. So if one has kidney yang deficiency, one may present with symptoms like a dull ache in the knees, feeling of cold, weakness in the legs, suggesting a vital need to warm and invigorate the body's yang energy. Now, dampness will tend to manifest in heaviness and edema with pain that lingers like a persistent fog. Addressing these imbalances through tailored treatments is essential for lasting relief. Because the knees are influenced by the kidney energy, it is important to differentiate knee pain due to kidney deficiency from that due to painful obstruction syndrome. When it is due to kidney deficiency, the knee pain is usually bilateral and develops very gradually over a long period of time. In addition, the knees feel weak and cold, especially if the kidney yang is deficient. This type of knee pain, kidney pain due to kidney deficiency, is not affected by weather. So it happens anytime, and the knees would not be swollen. So I think you already know what to do. Okay, what we should be focusing on today is the painful obstruction syndrome, or when it is due to invasion of pathogenic factors. So in this case, the knee pain is more often unilateral, or it can be worse on one side, and it starts fairly suddenly. It is definitely affected by weather, and the pain worsens when the weather is rainy or damp, no? And the knee may be swollen. So when the knee is swollen, we all know that this indicates retention of dampness. Painful obstruction syndrome of the knee often occurs from a combination of factors. And what are these factors? The invasion of external cold and dampness, and a previous local stagnation of qi due to an old accident. Okay, so if you had injuries before, we consider that as painful obstruction syndrome. Okay. Another frequent cause of knee pain is, of course, local stagnation of qi and blood from overuse of the joint. And this occurs in bricklayers, joggers, cleaners. Okay, so those who love to jog a lot, no? Be careful with your knees. In this case, it is not, strictly speaking, painful obstruction syndrome, but we have the same treatment. Okay? So the treatment of acute and chronic cases is not significantly different. So they can be discussed together. So ibig sabihin, we will be discussing both the acute and chronic because the treatment is the same. The most important factor to keep in mind when selecting points is to clearly identify the channel involved according to the site of pain. Okay, so these are the possible sites of pain. Pain in the knee may occur in the front, along the stomach channel, above the knee, inside the joint itself, on the inner aspect along the spleen and liver channels, and in the back of the knee in the popliteal crease. Now, there are 3 distal points. Okay, diba, when we treat the pain, we always start with the distal, no? 3 distal points can be used for knee pain according to the channel involved. Okay, so we have spleen 5, GB40, and stomach 41. Since our topic today is ear acupuncture for knee pain, I would like you to take a screenshot of the 3 distal points. And okay, so there's spleen 5, we have GB40, and stomach 41. So let's get to know each point well. Spleen 5 is the main distal point to use. Okay, it expels dampness, and since it is a river point, okay, it affects the joints. So use river points when you have joint issues, okay? It can be used as a general distal point for knee pain, irrespective of the channel involved. So no matter what the channel, you start with spleen 5. So this is a metal point, sedation point. It is also called a calm sleep point. And the patient will tell you, nakatulog siya ng mahimbing. Okay? And that's very good. And it is also called the reunion of veins point. So TCM practitioners consider this an important point for resolving damp. So this is the spleen 5, original location for the body. And then we have spleen 5. So in here, you need to be able to look at the undersurface. Okay, spleen 5. Does everyone have the probe? It is quite useful in this regard. Okay, the use of the probe will ensure correct needling of the point. Next is gallbladder 40. This is another distal point. If the pain is located along the gallbladder channel. Okay, so as practitioners, you are familiar with the gallbladder channel. GB40 is classified as a source point. It is also known as the unshakable calm point. It can be effective for joint pains in the hips, wrist, knees, and for sciatica and rib pain. You'll be surprised. Now, this is also good for wrist pain. Okay? Gallbladder 40. This is a classic point to use after surgery to encourage faster healing. So take note of its location on the ear. Can you see it? Gallbladder 40. Okay, then we have stomach 41.
Stomach 41 ba yan?
Yeah, stomach 41. On the ear, it is located.
Wala akong ano, hindi ko pa nakuha yung laundry nyo eh. Wala pa akong budget eh.
Okay. Can we please mute our nakaka-distract? Okay, anyway, stomach 41 is used as a distal point. This time, if the pain occurs along the stomach channel. So kanina, you use gallbladder 40 pag nasa gallbladder channel ang pain along the gallbladder channel. For this time, you use stomach 41 if the pain occurs along the stomach channel. Okay? So this is called a fire point, tonification point. It is also a Jing River point. In fact, they call this the energy and happiness point. So if you want your patient to be happy right after, especially if the pain is located along the gallbladder, along the stomach channel, stomach 41. So you have the location in the ear. Okay, as you can see, it's just right above the crus of the helix. No, it releases obstructions or blockages throughout the length of the stomach meridian, particularly when cold and damp are present. So as practitioners, I think we are already familiar with the fact that you should always start with the distal points, no? So you already have spleen 5, GB40, and stomach 41. So for spleen 5, it doesn't matter where the pain is located. okay? Whether it's gallbladder or stomach channel, you can still use spleen 5. Okay. Now we proceed to the local points. Local points are best discussed according to the area of pain. Local, diba? So first we have pain above the knee. When you have pain above the knee, this affects the stomach channel and there is some swelling. So if there is swelling, that means there is retention of dampness. So the main point to use for pain above the knee is stomach 34. So the main point is stomach 34. Okay, how do you classify stomach 34? It is known as the she-cleft point or accumulation point of the stomach channel. Okay? So you put the probe there. Kung masyadong masakit, then it's going to help the patient. And as an accumulation point, it is a good point to stop pain and remove obstructions from the channel. If possible, you can do moxa here. You can use a warming needle. Okay, warming needle. So for those who are so excited about the ear acupuncture point, nandiyan po ang stomach 34. So as you can see, it's just located across stomach 41. Okay. Now, if the pain is on the lateral side, okay, it could mean that the gallbladder or the stomach channel is affected. Okay. If the pain is on the lateral side, there is usually stiffness of the knee and difficulty in bending. Okay. So take note of that. The main points to use are as follows. Stomach 36 is the main point to use, your very favorite point. And the corresponding stomach 36 on the ear is that point. So besides all its other functions, stomach 36 can also expel dampness from the knee. It is called an earth point and a Harari point. No? It is also called a Madanyang, heavenly star point, or divine objectivity point. Okay, then another local point would be GB34. This is the gathering point. So this is for pain outside the knee, no? A lateral side of the knee. GB34 is therefore very important to use if the knee is stiff. So this is called an earth point, Hussey point, lower Hussey point of the gallbladder, influential point for the muscles and tendons or sinews. It is called a quiet courage point. So if you are interested to look it up on the ear, you can use this point. Okay? Gallbladder 34. Excited? Okay, gallbladder 34 is excellent for improving the articulation of the knee. So you consider using GB34 if the lower limbs are in spasm or are cold or numb. Next is GB33. Okay, gallbladder 33 is a useful adjacent point to use that also relaxes the tendons. So do you notice the big leap in the ear, no, from the GB34 to GB33? Okay, what I usually do is I just ask the patient to pull the ear on that area, and you'll be surprised. The pain is relieved. Okay, it can be used with good effect for knee problems, GB33, like arthritis, swelling, pain, or cold in the joint. It is beneficial where the patient cannot fully straighten their leg. Okay, those who are unable to fully straighten their leg, you can use gallbladder 33. So to make it more amazing, you can use the ear. Next, we have what about if the pain is on the inner side of the knee? So this involves either the spleen or liver channel. Okay, so this usually occurs in chronic cases, and you would often see a swelling in this area. So I think by this time you already know a favorite point here, which you need to needle. The main points to use are, of course, we have spleen 9, one of the main points to use on the spleen channel. It must always be needled if the knee is swollen, since this one indicates the invasion of dampness, and this point resolves dampness. It is called the water point, Hussey point. Tenderness of this point on women may indicate the presence of hormonal problems. Okay, so you might see patients coming in with hormonal problems. So to confirm the diagnosis, you try pressing on spleen 9. Next would be liver 7. So please take note of its corresponding location on the ear. Liver 7, it means knee gate. It is a special point to expel dampness and cold from the knee. It also relaxes the tendons and relieves stiffness. We consider using liver 7 for arthritis or rheumatism that gets worse with wind, a force that can also trigger anger or agitation within some people. Of course, when you're in pain, especially these days, diba? You get to be irritable. Then lalong sasakit yung knee. Next is liver 8. Okay? Liver 8 expels dampness and nourishes liver blood. So it's very good for people, especially women, who have liver blood deficiency. It therefore also relieves stiffness by promoting the nourishment of sinews by liver blood. It is particularly important to use in old people because we all know that when you are not young anymore, we have an underlying deficiency of liver and kidneys. Okay? And liver 8 is called the tonification point of the liver, diba? So this is also called a flexibility point. And we use this for troubles with the muscles, ligaments, and tendons, particularly around the knees. Next, what about if the pain is inside the knee joint? The pain is experienced deep inside the joint. And the main points to use are as follows. Okay, are you familiar with the extra point Shiyan? Yeah, these are a pair of points in 2 depressions, medial and lateral to the patellar ligament. Shiyan means knee eyes. They are called lateral and medial Shiyan, and the lateral one coincides with stomach 35. Okay, so they are best needled with the knee slightly flexed after placing a small pad under the patient's knee. The Shiyan point should be needled at least 0.5 inch deep. The warming needle can be used with good results unless the knee feels hot to the touch. And of course, if the knee feels hot to the touch and the patient doesn't have any yang deficiency, then you do not moxa, no? Okay, and of course, if it's swollen, it denotes that there is heat painful obstruction syndrome. And of course, the ever famous stomach 36, which expels dampness, it can also be used when the pain is felt inside the knee joint. Okay? Stomach 36. And lastly, we have pain at the back of the knee. This is quite rare, and pain in this area occurs much less frequently than in the front or sides of the knee. And if you have pain at the back of the knee, this is due to invasion of dampness in the bladder channel. And what do you think is the main point? Your favorite bladder 40. Okay? And take note, on the ear, this is where the bladder 40 is located. Okay? Bladder 40, besides being the local point for pain behind the knee, it also expels dampness, and in particular, damp heat. It is an earth point, lower Hussey point of the bladder. Okay, they also call this the greater assembly point of the back and vertebrae. Madanyang heavenly star point, and it is an accumulation point of blood. This important point can bring stability and equilibrium to an anxious, disorientated, or fearful person. And another good thing about this point is that it can have a direct effect on the spine as a whole, along with bladder 60. And this is helpful after osteopathic manipulations. So for those who do bone setting or those who are osteopaths or chiropractors, using bladder 40 and bladder 60 can make your patient feel better. It is considered for knee problems, lower backache, urticaria, arthritic knees, swollen feet, or loss of head hair. So knee pain affects approximately 25% of adults, and its prevalence has increased almost 65% over the past 20 years. So parami na ng parami po yung cases, accounting for nearly 4 million primary care visits annually. Initial evaluation should emphasize excluding urgent causes while considering the need for referral. That is why we have trainings on assessment so that you would know who to refer and you would know. And usually the patients who come to us are those who have already seen a primary care physician. Diba? Knee osteoarthritis. This is very common. This is a degenerative joint disease affecting the aging Filipino population. Osteoarthritis, which is also known as degenerative joint disease, is the foremost predominant chronic rheumatic disease and is a leading cause of pain and disability in most countries worldwide. Most of osteoarthritis affects the hips and knees. So last time we discussed the hip, and now we discuss the knee. It has been evaluated that the percentage of people aged more than 65 years old in Asia will increase twofold from 6.8% in 2008 to 16.2% in 2040. In the Philippines, its prevalence is 0.5% in individuals aged 20 years and above, and increases to 11% in the population aged 60 years and above. Thank you for your attention. Okay, before we continue, I would like to acknowledge the presence of Dr. Tancho Chong. Good afternoon, sir. And of course, Dr. Gavino. They are two legends in the acupuncture community. Okay. Any questions?